Okay, so thanks for joining me, Javier. We are recording this little video discussion between us because we presented it to the Calgary Catholic Medical Association last weekend, and there was a lot of interest in hearing our perspective in the community because some people aren't aware of how significant an impact things were for long-term care. At least they don't know the stories that impact you and I, for example, and other people who work in long-term cares and continuing care, as well as the residents. So my name is Thomas Bouchard. I'm a family doctor and medical director at Lacombe and Providence Care Centers. And Javier Martinez is the resident care manager at a supportive living site in town, St. Marguerite Manor, which is a Covenant Care site. And so he and I are going to just share some stories about COVID and how it impacted us. One funny story just to start us off is that I had this one gal. I've got a few old gals who like to kiss me in the long-term care, and they'll often do it after breakfast. So I make sure I do my hand hygiene after I get these kisses. But this one gal saw me with my mask on, and she had dementia and obviously couldn't remember the word for a mask. So she said, "Dr. Bouchard, take that piece of cotton off your face and give me a kiss." And I said, "Sorry, I can't do that. It's against the rules." So she said, "Well, let me kiss your hand then." So she gave me a kiss on the hand, and just a funny story to start us off because, I think there's, even among dementia residents, there's a lot of resilience despite the masking, because I know some people who don't like the mask critique it and say, this is a problem for people. But I find that people recognize my voice even through my mask, even people with dementia who hear my voice, and they will tell me they remember me because they hear my voice and they hear it every week. So that's good. I mean, it has been a difficult year with restricted visiting and with having less activities, which we've tried to adapt to over time. Doing some more virtual visits with residents and their families. I know one of my patients, his daughter wrote an article in the Globe and Mail saying that she got closer to her father during COVID because of their interactions over Zoom or however they were doing it, having these virtual visits, because she's in another province and she was able to connect with her dad more during COVID than otherwise. So that was cool. And at our sites, we did have some cases and one death, which I'll talk about a little bit later. But Javier, you have more experience with a severely hit site in Edmonton. So I just want to invite you to share that and tell us about that experience and what that was like.
Yeah, thanks, Thomas. Yeah, I did have the unfortunate experience of working in one of these really, really hard hit sites in Edmonton. As Thomas mentioned, I'm actually located in Calgary, but we received notice from one of our sites in Edmonton that they were having a lot of difficulties. And this site is a smaller site, so from a resource perspective, I mean they typically already deal with a very lean resource allocation. So they needed some help from other sites, around the province to provide some support. So, I immediately texted the leadership and I said, "Hey, if you need me, just let me know in what way you want me to help out." At first, honestly, to be honest, I was thinking, maybe from a strategic plan or education or something. But then the next text I got was, "Can you go to Edmonton right now?" So I was like, "Okay, okay, I'll go." So I spoke with my wife and the family, said, "Okay, this is what's going on." And of course I got the blessing from my family. And I headed off immediately to Edmonton.
You told your wife that you didn't know when you'd be coming back, right?
Yeah, pretty much. Like, I mean, I took X amount of clothing, and I said, "I'm not sure when I'll be back. It'll be a few days." So they said, "Well, just keep us posted on how you're doing, and then we'll take it day by day," kind of thing. So So anyways, I was very happy that, they provided that blessing. And then of course I went. Um, so when I got there, I was debriefed of what exactly was going on and how the outbreak started. So a little bit of the background is that unfortunately, this was a resident that had come back from the hospital, and ended up getting COVID while in hospital. And to on top of that, this was a person who was in the dementia care ward, or in the memory care area. And as many of you may be aware or not, but it's a big challenge to keep people in isolation in memory care. And unfortunately, this was not a person who was easily redirectable. So this person ended up transmitting COVID to easily transmitted COVID to the rest of the residents in that ward. And unfortunately, through other staff, COVID went to the other areas in the building as well. So it got hit pretty bad. When I got there, the situation was really, really desperate. The severity was really bad. When I got there, most of the residents were already on contact droplet isolation. Everyone was in quarantine, so everyone had to stay in their suite. But the majority of them were already on contact droplets. So anyways, anywhere, like in other words, you had to don and doff with your full PPEs before going in and out. That in and of itself takes a significant amount of time. So I mean, even to give, let's say, a cup of coffee, you had to don and doff for a large amount of the residents over there. At one point, the situation was so dire that there was no staff that day. Literally, like it was myself and some of the other leadership who were the only staff there to provide care to the residents. So when I got there, I mean, I did everything, from helping with PPE planning and disposals, to long-term planning, to also I did care to any resident who needed care, help brush their teeth, serve the meals, throw out the garbage, anything you can do. And I know that, and one of the things that I noticed is that it was so easy to, um, uh, because of the rush that you're going through to try and reach as many residents as possible, I could see that there would be a lot of issues with following the PPE protocols. I could see where a lot of the gaps were there. And I know, and one of
On
go
that
ahead.
point, I was talking to a nurse at one of the hospitals who works on the COVID unit, and she said that all of her nurses there, none of them got COVID for the first year, and then later they got COVID through school transmission from their children. And
Oh,
it just goes to show that the PPE donning and doffing is it works, but under high stress situations like you were in, like you're mentioning, like the PPE protocols, when there is such high demand for people needing care, it's almost impossible to make sure that all the PPE protocols are followed, right?
I think that is highly underestimated of how
Yeah,
much of an issue that is. Even the most strict people with PPE protocols, if you're under a significant amount of pressure, in order to follow, because it is a science actually, the proper donning and doffing,
yeah,
under a significant amount of pressure, it is extremely difficult to follow the proper protocols, even for the strictest of us following the PPE protocols. So when you
yeah,
have really no staff, and all of a sudden you're bringing people in from agency who's never done this before,
yeah,
I mean, it's not a good situation to be in.
yeah,
And the unfortunate part is because the outbreak was so bad, it did not allow, we unfortunately, families and visitors were not allowed into the building. And that was a little bit, I wouldn't say it was super early in the outbreak, but it was early-ish. So we were still trying to learn a little bit more on the outbreak. But because, first of all, there was no visitation, and also there was no visitation among residents also. It created pretty much almost like a hopeless situation for the residents in the building. So many of them were suffering already from COVID. But also, I would say pretty much most of them were already suffering from that social isolation as well. One of the most moving moments when I was there, and one of the hardest gut-wrenching moments when I was there, was to see the hopelessness that a lot of our residents were going through. There was one resident, actually, she was the sweetest, one of the sweetest little ladies I met there. And I remember one night, we're trying to finish care with a lot of the residents at night, and she was such a beautiful soul. She would go out of her suite because she wanted to say goodnight to all the residents in their suite, and that was a routine she wanted to maintain. But we couldn't, like, sorry, but you can tell goodnight to your friends who are sick with COVID right now. And that was gut wrenching because she really wanted to get that she wanted to be in touch with her fellow residents. And unfortunately, when I remember, actually, I was having a conversation, after seeing so many of the residents over there, especially those who had COVID. And I remember, just talking to them, I could see the biggest thing that was lacking there was hope. And how do you create hope when we're completely out of the loop? I mean, not out of the loop, but we're in complete chaos because of how severe COVID had hit there, and we didn't even have the resources to provide proper care for the residents. So it was pretty dire.
And how bad did it get? Like, how many people had COVID and how many died?
So the building had about 50 residents or so. And of those 50, only 5 did not get COVID. And I would say about 20 to 25% of the residents died in that building because of COVID. And unfortunately, pretty much all of them, or if not most of them, ended up, dying alone, actually. So it was a really, really, like, it was, what I would say, it was probably one of those worst case scenario situations. So as we were talking a little bit earlier, the issue with the PPEs, and when you're in such amount of pressure, that's kind of the situation that happened with myself as well. After I stayed there for a few days. I can't remember. I think it was like 4 days or so. Very long days. I mean, we're talking 14, 15 days. You kind of get up, go there, and then go back home, sleep for a few hours, and then go back. So that was kind of my routine for a few days when I was over there. One of the things that did happen was when I was in memory care, talking about PPEs, I'll be doffing off my PPEs, changing my PPEs after I saw a resident who had tested positive. As I'm taking my mask off and my eye protection, this resident with dementia would be right in my face, just smiling and talking to me. And I remember thinking, oh man, I'm so done. I'm pretty sure I'm gonna get COVID. Like, I mean, this positive resident was just in my face right now, and that would actually happen quite a bit. So, speaking of, donning and doffing there, and, the pressures of, what happens there when you're in significant pressure and under COVID, when I went home, actually, I kind of figured, the probabilities of me getting COVID is going to be significantly high. So I remember when I got back home, I decided not to go straight to work because, it would be going to St. Margaret Manor. And I told my supervisor, you know what, I think I'm just gonna take the rest of the week off, or I'll work from home. I'll get myself swabbed, and if it comes back negative, then I'll presume everything was okay. But it was like a day later, after I got home, I started developing symptoms, and it was like the standard COVID symptoms. So it was, the chills, the cough, the fever, headaches, and this is extremely unusual for me. I typically don't get these symptoms, especially all at once. I remember thinking, I have COVID. There's no doubt about that. And so I did get swabbed, and surely enough, my results came back positive. Of course, I'd received tons and tons of support from leadership, from the organization. So I'm extremely thankful for all the support that they provided. But then I had to confront the tough situation at home. I do have 5 kids. Most of them are very small kids. So I have at the moment I had a 2-year-old and a 4-year-old. So, how do you isolate from, from a 2-year-old and a 4-year-old, and then I have 3 more kids? So it was going to be mission impossible. There's no way that could have happened. No matter how you would do that, they would always sneak in on you. And unfortunately, they didn't have the isolation hotels as we have them right now. So needless to say, 2 more in my household did end up getting COVID as well. So my youngest daughter and my oldest daughter, fortunately, their symptoms were mild to non-existent, so which was great. But I know that when I ended up getting COVID, it did hit hard for about a day or so, but then it kind of mellowed out for a bit. Now, the interesting part was after my 10-day isolation, I went to run some errands, and I noticed actually that when I was driving, my reaction time was extremely impaired. Actually, there was a few times actually where I thought I was going to get into a car accident. I was actually quite concerned about driving under these conditions. The other thing was the amount of fatigue I had actually. And I remember, I was very happy to receive a call from my physician actually. And he assured me that typically it would take about 6 weeks or so. And it did take a few weeks for the fatigue to wear off. But I did get over the fatigue after a few weeks. The other interesting kind of lingering symptom that I had for a while was the fogginess actually. Like I did experience some cognitive, it was almost like a cognitive impairment actually for a few weeks also. And I was very happy actually that, at least at work they could recognize that I may not be the typical person I am. Excuse me. So that interesting enough lasted for quite some time. But then the other one actually that also lingered was my sense of smell and my appetite. I noticed that I had no appetite during this time, and my sense of smell was strange. Like I always had like this weird sense of smell, it was almost like this phantom smell that I would have, and my appetite it was just not there because this smell would just would take away my appetite. And I remember thinking actually, if a senior from, let's say from the manor who lives here were to get a similar symptom to myself, which was, no appetite, like they won't survive it because it was pretty severe actually. And surely enough, that's kind of what happened here. We had a resident that the only way we were able to clue in that this person tested positive for COVID was because he was drinking his regular Ensure, and he said that it tasted funny. And when we smelled it, there was no difference there. And it was a very astute LPN actually who identified that, and we tested, and surely enough, this person had tested positive for COVID. And I remember thinking, I kind of got a sense that this person had a very similar symptom to what I had in terms of the appetite. And unfortunately, I remember thinking, this person won't survive. And he was one of the 2 people actually that died in our building because of that. Him and his wife actually died a few hours apart from each other.
Wow.
So
that brings up one of the stories that I had. So at my sites, we didn't have a lot of cases, thank God, that 6 over the course of the last year, which we were comparatively really preserved from the COVID hit. But one of my patients, the only one who died with COVID, was an old gal who ate like a bird in the first place. She ate very little, and she was just off. She wasn't herself, and that's just being slightly off was the symptom that led us to swab her. And she was COVID positive, and I tried everything, and she developed respiratory symptoms. We had her on oxygen, and we gave her some dexamethasone and some antibiotics. And from a respiratory point of view, she recovered and was quite stable, but she didn't want to eat. And it brings up all these symptoms that you're describing. Like, of course, she doesn't want to eat. And I told the staff she loved ice cream. I said, give her as much ice cream as she wants. Like, just don't hold back. Give her all the ice cream she wants. And she didn't want it, right? And so your point is really important, that elderly people who don't eat at the best of times, but if they have reduced appetite, decreased smell and taste, it's going to be really hard for them to recover their strength after a serious respiratory illness. So that's definitely a big factor too. And I think I was wanting to fight things for her, like I wanted to throw everything at her so she could recover, because I didn't want her to be a statistic. There was 150 deaths at the time in Alberta. I didn't want her to be 151. I didn't want that to be on my head, but I really had to kind of give that up and realize that it isn't about me or kind of my pride and how good a doctor I am, but it really was about accompanying her and doing what we could, and really following her as far as her own cues of how this would go. And in the end, the consolation for me was she received the sacrament of the sick. She had her son and me there at the bedside, of course with PPE, when she died, and it was as peaceful a death as you could imagine, even though it was with COVID. And I think that was a good lesson to me, that we can still accompany people and be with them in nursing homes, even though there are also these horror stories of people dying alone as well. And it just goes to show that there are differences across the board with what happened in the pandemic, but continuing care in the elderly were hit really hard. And it really bothers me when I hear some people complaining about restrictions and lockdowns, and they'll say things like, well, certainly earlier on when it was a higher average age of death, when people say, the average age of death is an 81-year-old, and I think, well, do 81-year-olds not matter? All of a sudden, because it's the elderly who are dying, we don't take it as seriously. So those types of comments bother me. And on the point about restrictions and lockdowns that a lot of people have struggled with, I think it's really ironic to see this past month, at the same time as there were more severe lockdowns because of the spread in the community, in continuing care, we were able to open up visiting, like the total opposite, because our vaccination rates were very high, and we had done so well. And coming from that really difficult situation which you described, to now feeling like when I go to the nursing home, I'm safer than I am in a grocery store, that I think it should really send a message to people that the vaccination portion of things is a critical piece of the story. And it simply demonstrated by the fact that we're able to open up visiting at nursing homes at the very same time as we are locking down and increasing restrictions in the general community around us. So any comments from your perspective on kind of the vaccination story and how what you've seen in your facilities?
The vaccination has been an absolute game changer for us. Internally the numbers, but first of all, I was really happy to see that they prioritized the nursing homes to get everyone vaccinated as soon as possible. And then once that happened, the dramatic change in terms of what we were seeing for outbreaks was just astounding. Actually, I think honestly, yeah. I think we were, to be honest, I was actually a little surprised at how good it worked. We saw, I think, what was it, over a 90% drop in the outbreak cases. And it's not just the outbreak cases. I mean, it's interesting because right now we're seeing outbreaks kind of creeping up in continuing care. But that's only part of the story. I mean, when I press on AHS to, AHS leadership to give me a little bit more information on what exactly is going on with these outbreaks, it was actually it was very good to hear that the cases have been happening because of unvaccinated people getting COVID from the community. But the good thing is that people are not transmitting within the sites. So that's not been happening because of the vaccinations. And not only that, but then there's been a handful of cases where people have actually gotten COVID from the community who were actually vaccinated, but then the symptoms have been mild to non-existent, which is also one of the benefits of vaccination. So it's been and so anyways, on that front, in the sense that we're not dealing with outbreaks and lockdowns and the restrictions because of outbreaks, not as much, is absolutely fantastic. I remember I actually had one resident here who's a younger gentleman, very smart guy, but he the outbreak had been really difficult on this gentleman, because unfortunately because of the two visitors that he was allowed to, and he has a few kids as well. He hadn't been able to see his kids in, I don't even know how long actually, but he said, if I had to deal with one more outbreak, I'm actually going to kill myself. Like, it was that severe for him. So
Yeah,
to actually see things opening up more is a
yeah,
huge sign of hope,
yeah,
for all our residents. And you're right. Like, I mean, the amount, the dichotomy that we're seeing between what's happening out in the community to what's happening here in continuing care is actually astounding. I think it was like even the same days where things are opening up, things are closing down in the
yeah.
community.
That's right. That's right.
Um, and I do share with people, I was like, this is kind of like a microcosm of what things can look like.
Yeah,
If we're seeing a good intake of the vaccination, we could be
yeah,
seeing a lot more openings out in the community if people just, rolled up their sleeve and get vaccinated.
yeah,
People ask me about it, well, what do you think? It's like, I tell people I haven't had a chance to read in depth a lot of the research behind it, but I could tell you the effectiveness of it. It's been astounding. And not only that, like, I mean, one of the things we were kind of cautious about was what was going to be the what side effects we're going to see with our seniors who took the vaccine, and it was absolutely minimal. I think only two
hmm,
of our residents had minimal side effects because of the vaccine. So
yeah.
I have to
And
say it's been extremely, extremely effective.
yeah, and I think, all of our nursing home and continuing care sites got the mRNA vaccines. And, there's certainly some questions that people have that are good and honest questions that we need to answer. And so the Calgary Catholic Medical Association developed this resource to kind of point out some of the differences between the vaccines, both from an ethical point of view and maybe some side effects point of view. So yeah, there are things that could be said about, say, the AstraZeneca vaccine that is different from the mRNA vaccines like Moderna and Pfizer. But like you said, our communities in continuing care are a microcosm to kind of look at the differences between what we did as a group, as a community, and how that has changed our experience of the pandemic. That isn't happening in the wider community because of a lot of division and lots of politics as well that people are questioning, and there's a lot of anti-mask sentiment, a lot of anti-vaccine sentiment. But I think a big message that we can learn from long-term care is we can get through this together if we work as a community, and it is going to take the vaccine to help us get through this, right? And I think we really need to see that good things can come from a bad situation like COVID, and the ingenuity with the mRNA vaccines in particular is phenomenal. And for people to look at the science from a non-political point of view and just look at the science of a really amazing technology in the mRNA vaccines, and to see that the trials have been well done, really good quality studies. Hundreds of millions of people have received these vaccines, with certainly in the mRNA situation, very little side effects. A little bit of anaphylaxis, not very common at all, but can be treated, and some rashes, also very benign. So it really is a great success story from the vaccine point of view. And I think if people were able to learn from the tragedy of what happened in some situations to our elderly residents, and see how we are able to get through it in these continuing care facilities, that might help some people think through what they would like to do themselves to help protect the community. And on that point about mental health, you had mentioned some of the challenges with people in outbreak. There's lots of mental health issues, for people in lockdown or losing jobs and stuff. But we really can't say it's one or the other. Either you have a mental health shadow pandemic or you have the COVID pandemic. We should fight both, right? You know, fighting the COVID pandemic with a vaccine and fighting the mental health issues by really being a supportive community and not letting people get to that stage where they are hopeless. And our continuing cares are good examples of where we do rise to the occasion as staff and families to help people when there is the mental health crisis as well. So I don't like when people pit the two against each other as if, you know, if only we didn't have restrictions or lockdowns, we would have way better mental health, or, you know, if only this or if only that. You know, I think we can do both and help people both with the struggles in mental health, but also the issues with the pandemic. And I think we've shown that in the continuing care setting.
And, you know, that's a good point. There's two things I wanted to mention, actually. And that's, you know, in terms of the mental health part, that's actually one thing we did, is that while still, you know, being faithful to, you know, to the COVID guidelines, we also enhanced our mental health support for our residents. So, for example, you know, this particular individual, for example, we did some changes in terms of the visitations for him, which allowed for better visitations for, let's say, with his family, actually. So that actually was a huge support for him, while at the same time we were able to stay within the guidelines, with the COVID guidelines as well. We had a better way of assessing also different residents who were struggling with mental health issues. So we provided some extra supports for those scenarios as well.
Yeah.
But you mentioned something really, really good, actually, which was the unity of the, you know, or which kind of prompted me to think about something, which was the unified message. I guess when you think about it, actually, continuing care has had a really, really strong unified message, especially when it came to the vaccines. And I think that's where you see a lot of the successes. While you hear a lot of the, you know, the fighting that's going out there in terms of, you know, the polar discussions of, you know, what's right, what's not, et cetera, the vaccines or not, restrictions or not. I think, you know, continuing care has been very unified, and I think that's what you're seeing the successes. Like, I mean, here, I mean, they've been wondering for a long time, when are we going to get the vaccine? When are we going to get the vaccine? It's not just the residents, but residents and families. Everyone had the same message, the same vision of what they wanted. They wanted everyone to get vaccinated. And because of that, actually, there's been so much success now. So just wanted to point that out as well.
Yeah, exactly. And just this notion of, you know, the question, am I my brother's keeper? You know, do I care about the other person, or do I take a more individualistic approach and say, you know, what are the side effects for me? I'm going to think about all of the negative consequences, when really maybe a better question is, how can I help the community? How can I help my neighbor, even if I might have a few minor side effects? And I don't want to belittle people who may have some more significant concerns with the vaccines. That's not what I'm talking about. But in general, I have to say that the mRNA vaccines have shown very little as far as significant side effects. And even from some of the questions about the ethics of the vaccines, the mRNA vaccines have far less concerns, if any at all. So I think the lesson to be learned from continuing care and from our elderly who wanted to get out of this more than anyone, I think we should take that lesson to heart and say, you know, what can we do to support our community as best we can to get through this together?
Actually, which reminded me, so one of the things that we had to do as part of the COVID guidelines was do kind of like a temperature check with our residents. How are they feeling about the restrictions, and, you know, what do they want to do? The general, it was interesting, the feedback about being more community oriented is that, and I heard this so many times, a lot of the residents said, look, I've had a good life. I actually don't care if I get COVID myself, or even if I die because of COVID myself. However, I do care about my neighbor. I do care for those around me, and I will abide to the guidelines because of my neighbor. So it was a very, very, very community oriented approach to it. Like, for them, you know, they're happy. They're happy.
Yeah.
but they did not want to be the person transmitting COVID to their neighbor.
Yeah, for sure. Yeah, that's great. And I wish that we could share that message with other people, and hopefully with this video we can share that and might help some people understand things a bit better.
Mm-hmm.
Awesome. Thanks, Javier. I appreciate it.
No problem, Thomas. Thanks for the invite. It was great chatting with you.
And keep up the good work.
Thanks, you too.
Okay, take care.